Occlusion. It is the contact of masticatory and incisal surface of maxillary and mandibular teeth. Before the tooth eruption, maxillary and mandibular arches are known as gum pads, but the maxillary gum pads are wider than mandibular pads. Spacing in deciduous dentition is necessary for the proper alignment of permanent teeth. Natural spacing in the maxillary arch, mesial to canine, and in mandibular arch, distal to canine is known as primate space, or anthropoid space, or simian space. According to Baum's classification, based on the distal surface of deciduous second molars, there are three planes: flush terminal plane, mesial step, and distal step. In flush terminal plane, distal surface of both molars are in vertical line. In mesial step, there will be a mesial shift of mandibular molar. In distal step, there will be a distal shift of mandibular molar. Mixed dentition. It begins at the age of 6 and lasts up to 12 years. Total mesiodistal measurement of deciduous canine and molars are greater than that of total mesiodistal measurement of permanent canine and premolars. Difference between these measurements are known as leeway space of Nance. This is 1.8 mm in maxilla and 3.4 mm in mandible. This space is utilized by the permanent first molars to drift mesially to develop class 1 molar relation. At the age of 8 to 9 years, when anteriors erupt, crowding occurs for a short period. The difference between the space available and space required to accommodate this large anteriors known as incisal liability. This is overcome by increase the intercanine arch width or labial inclination of permanent incisors. Occlusal planes and curves. Curve of Spee. It is the anteroposterior curvature along the incisal and occlusal surfaces of mandible and the condyle. Wilson's curve. It is the lateral curvature in the molar region. It is concave in maxilla and convex in mandible. Monson's curve. It is the spherical curvature that passing through the molars and condyles. It has a diameter of 8 inch. Anti-Monson's curve. It is the lateral curvature in the premolar region. It is convex above and concave below. Centric relation. It is the most retruded and unstrained position of the mandible. The mandibular condyle will be in the uppermost and midpost position in the glenoid fossa. This is independent of tooth contact. Centric occlusion. It is the maximal intercuspation of maxillary and mandibular teeth, irrespective of condyal disc relation. In simple terms, we can say that centric relation related to temporomandibular joint and centric occlusion related to teeth. In complete occlusion, the palatal cusp of maxillary molars, seated in the central fossa of mandibular molars, and buccal cusp of mandibular molars, will be seated in the central fossa of maxillary molars. These cusps are called functional cusps, or supporting cusps, or stamp cusps. The buccal cusp of maxillary teeth, and lingual cusp of mandibular teeth, are called as non-functional cusp, or non-centric cusp, or guiding cusps. The centric cusps are broad and rounded, whereas non-centric cusps are sharp. In centric occlusion, functional cusps contacts the opposing tooth in two areas, central fossa and marginal ridge and embrasures. In an arch, each tooth occludes with two opposing teeth. But there is an exception for two teeth, mandibular central incisor and maxillary third molar. Types of occlusal contacts. Surface contacts. Cusp to fossa contact. Cusp to ridge contact. Ridge to embrasure contact. Surface contacts. Incisal surface of mandibular anteriors contacts the lingual surface of maxillary anteriors. Cusp to fossa contacts, mesiolingual cusp of maxillary first molar, contacts the central fossa of mandibular first molar. Lingual cusp of maxillary second premolar, contacts the distal fossa of mandibular second premolar. Buccal cusp tip of mandibular second premolar, contacts the mesial fossa of maxillary second premolar. Distobuccal cusp of mandibular molar, contacts the central fossa of maxillary first molar. Cusp to ridge contact. Distolingual cusp of maxillary first molar, contacts distal marginal ridge of mandibular first molar, or mesial marginal ridge of second molar. Buccal cusp of mandibular first premolar, contacts the mesial marginal ridge of maxillary premolar and canine. Ridge to embrasure and grooves. Triangular ridges of buccal cusp of maxillary first molar, contacts buccal sulci of mandibular first molar. Oblique ridge of maxillary first molar, contacts the junction of buccal, central, lingual groove of mandibular first molar.